everyone. Welcome to the Mural Supplemental Health Emergency Travel Information and COVID Information Session and Q&A. There's a lot of information to cover. Travel has changed so much since what we knew it was prior to March 2020, prior to COVID. We still want to travel. However, the bans, restrictions, mandates, vaccines, COVID itself have really changed things for us, and it's continuing to change. And so the information is subject to change at any time. So it's as accurate as it can be now, but it will not hold true if you're planning on traveling in March necessarily. So there's going to be a couple of important things I'd like to mention. Information that you should read carefully, especially about the McGill benefits. That hasn't changed. Some information to share, and then I hope we'll have lots of time for questions and answers and to share some information also. Next slide, please, Kate. You are covered in case of COVID while you are away under our emergency travel insurance provisions of our supplemental health plan, provided that, and we'll get into some of that later. So if you are a member of the supplemental health plan, you are covered. That hasn't changed. But testing for COVID is not covered. So whichever type of test, wherever you take a test, however many tests you take, that is on your pocketbook. The story online the other day, someone who had come up from the States for a long weekend in Canada ended up having 5 COVID tests and cost an extra $500. So that you may have to build into your budget. And the last one, just the caveat that the pandemic is not over with us yet, and things are changing all the time. And so we have to keep that into account and keep on checking for information to make sure what we have is the most up-to-date information. Next slide, please. So as a member of the supplemental health plan, you and any eligible benefits that you have are covered, and the provisions are, you must be covered under your provincial health care plan. Many of us here today live in Quebec still, and so it's under RAMQ, but there may be some online who are in other Canadian provinces, and so you have to maintain coverage. So if you're away long enough that you exceed the limit, 183 days in Quebec, varies slightly for other provinces, and you are no longer covered under the healthcare plan, then your coverage for the entire trip is negated. It must be a new injury, an unforeseen injury. It must be an emergency. Or if you have a chronic medical care situation, it must be considered medically stable. And it's up to a maximum of 90 days. So you can go away for 90 days, come back to Quebec for a little bit, 24 hours minimum, maybe a week, and then you go away again. And it's subject to a lifetime maximum of $5 million per person. So a medical emergency, sudden or for unforeseen, unexpected, medically stable, and it no longer exists when the attending physician and the insurer and supporting medical evidence decides that you are in good enough shape to be returned to your province of residence. It may be by an emergency air situation, but again, not necessarily McGill, but there was a situation a while back. The person had a heart attack in the hospital because you're covered for up to 14 days in a hospital situation. And the doctor and the medical one said, you're fit enough to travel. They wanted to return them to a hospital in Ontario, and they didn't want to go. They felt they wanted to continue to have the treatment there in the hospital or at their place in Florida. And because they did not go when they were told they should come back to their hospital here, the insurance was negated. So you have to keep in mind what the doctors say and what the insurer says as well. Next slide, please. Medically stable, very, very important to understand that. If you have a health situation that is a chronic situation, it may be heart, it may be lung, there may be a few other situations like that. It has to be stable for 90 days. Some other insurance policies with other companies, they have a longer stability clause. It may be 180 days. I've even heard of some that's 365 days for seniors. And it may get older, it may get longer as you get older, but ours was set up right from the beginning. 90 days you can be covered, but 90 days it must be stable, and it's before the departure date. So you must not be treated for any new symptoms. You must not have had any increase or worsening of existing symptoms. No changes in medications other than normal adjustments for ongoing care, for Coumadin, warfarin, or for adjustments to insulin for diabetic people. And that includes stopping medication. So if your doctor says you're doing so well, you don't need to take this medication anymore, that is a change in medication that might precipitate a medical situation. And so you can't do that either. You cannot have been admitted to the hospital within the past 90 days. And you also cannot schedule your tests and treatments for when you come back. So you can't get around it that way. So if you have annual checkups and there are things that you need to see your specialist for, try to arrange them as early as possible before you travel, so that you can get this out of the way and be in a medically stable situation before your departure, so that your medical coverage will be in effect. Next slide, please. Claiming expenses. So that's very important. Bring with you your little Manulife card if you still have it. Print one out. If you don't, they're not sending any more nice little plasticized cards. In addition to the information with the McGill plan contract number with Manulife on the front, your name and your certificate number. On the back, it gives the Alliance Global Assistance, which is the emergency health provider on the back, along with the plan number 9505. So make sure you carry that with you. You might even want to have a screenshot of it on your phone or your tablet or your laptop that you take with you. If you don't, and you have to contact them as soon as an incident happens and you think you might need medical care. If you are unconscious, then your traveling companion should call on your behalf. If you don't, they will then direct you to an appropriate doctor or hospital. They will ensure that someone is available to speak to you in English if you're in a country where that is not the usual language. If you don't contact them, then you may have to pay for all the medical costs up front. And when you return to Quebec with your itemized care list of procedures and treatments, submit the claim to RAMQ first, wait for them to educate on it, and then submit it to Manulife for any additional claims. If when you're talking to them, it's a very minor incident and the charge is going to be $200 or less, they may ask for you to pay for that up front and claim later. But you're covered for 100% of your emergency medical costs while you are away. Next slide, please. And this is from the benefits site, so you can link to it there. You can download the information and bookmark the McGill HR benefits information on your device that you take with you. But I just wanted to pull it out because these things are very important, because McGill sets the benefits for our plan. The staff benefits committee is involved in talking about some of these things, but it's the university's decision. Manulife is contracted to administer the plan. So if something goes wrong, contact Manulife first. You'll probably speak to their customer care representative. You may go up the chain. If you're not getting satisfaction, then speak with HR, because it is McGill that sets the changes. So when things change for other people, last March, in many cases, insurance policies began to restrict COVID coverage, encourage people to get home because they were cutting off the coverage. If you caught COVID when you were there, our plan didn't change. So coverages, as I said, new incidents, no longer when, and following is an emergency stay in the hospital, any prescriptions and medications that were given to you in the hospital or given to you to take with you when you leave the hospital are covered. However, any prescriptions you get and are filled at a pharmacy later on are not covered. And because you're away, you can't come back and claim it later. Coverage limitations, you can read that there. We've covered some of that. Next slide, please. There we are.
Hold on.
Very good. No, we're there now. Thank you. Oh, services covered. So you can see it's quite extensive list of services that are covered. The hospitalization is for the first 14 days that you are in hospital, unless the attending doctor certifies that the person should not be moved back to his or her home province and needs to continue in the hospital there beyond this period of time. So you're covered for hospital services, diagnosis, x-rays, medication, etc. 100%, very good. Not the 80% that we claim for certain things here in Quebec. Next slide, please.
I don't know, hold on.
I think we went a bit too far.
No, hold on. It's called a computer has a mind of its own. Why won't
Yes.
it go to the next one? You can see 10, but it's, there we go.
There we
Okay.
are. Oh, no, you.
It's
What
10.
about services not covered? Did that comes up later? Okay. You are covered for transportation. And when you read for other family members who are maybe traveling with you and are not an eligible dependent, and they want to take out some travel insurance, they say important things to cover is, you know, are you covered for medical emergencies? But are you covered in case of transportation? If you have a fall when you're climbing Uluru in the middle of Australia, are you going to be air transported to the nearest hospital in Alice Springs? Or if you are on an island, are you going to be able to be transported, if not all the way directly back to a hospital in Quebec, at least to a hospital somewhere else? And yes, we are. Air transportation is included. If one should be so unfortunate as to die, or your traveling partner, your spouse or eligible dependent, the charges are also covered for the return of the deceased member. And depending on coverage and that may be a cremation and sending the urn back or bringing the urn back, or it may be with a full coffin. And then for any of those who do have still very small children who are with them, if your trip is delayed because you are hospitalized towards the end of your trip, it is covered. It covers the return of a vehicle if you drove somewhere and you can't drive it back. It will cover for the return of your vehicle, but it doesn't cover rental cars. If you are transported somewhere else and back to Quebec and there's a rental car there, you'll have to make some other arrangements to get the rental car back to the place where you had rented the car. Next slide, please. Okay, so we missed.
No, hold on. I don't know, that's, oh, bear with me. It
Doesn't want to do 11.
I
does it?
know,
Like 11.
there we go.
Okay.
Okay.
Some services are not covered. You are not covered if you decide to become a medical tourist and go somewhere else to get a kidney, to do cosmetic surgery abroad, for routine tests and follow-up. You forgot your prescription and you need to see a doctor somewhere else to get a new prescription of your medication. There may be some retirees who've got very young spouses, so there's a pregnancy clause. Even if it's covered for pregnancy, if it's very early on and childbirth comes on, childbirth is not covered. So you're covered, you have to pay for those expenses. And as I said, if you lose your provincial health care coverage, everything is off the table. It's not covered for trip cancellation and trip delay policies, and it's not covered for lost luggage. Next slide, please. So you might want to consider trip cancellation and trip interruption insurance. It's available from a number of insurance providers. Manulife is one. You can call them and ask about it and see what the conditions are and the costs and so on. However, I've heard recently that because COVID is a known factor now, that many policies have an exclusion for any COVID-related expenses that you might cover, unless you get COVID. If you get COVID-19 and you need to be hospitalized, and therefore you cannot go on a trip that you have planned, but you have already paid for your airfares and resort fees or cruise, etc. If you have COVID, then with a medical note, you can get a refund, but you can't just change because, oh, there's too many COVID cases in South Africa and I don't feel comfortable going there. It's a known case, and they say you should have taken that into account, that COVID could change at any time, and not plan your travel. And if a travel advisory changes, the Canadian travel advisory should change. This is, they're very important in the one of the early slides, there was information that you can look on the Canada website on travel advisories, and it gives you lots of useful information by country that you can see about the health status. And so it used to be that if you were planning a trip and the travel advisory was level 1 or level 2, travel with usual precautions, travel with high caution, and you booked the trip, taken out insurance, and then the travel advisory changed before you were away, or even while you were away, then you would be covered in order to be able to cancel your trip or interrupt your trip and get back earlier than planned. Then with COVID, they began to change things and say that it's known and we can't predict when COVID is going to happen. So if a travel advisory changes, you're out of luck and it won't cover you for that. So you can find that you're still going to be covered for certain expenses, and it's for COVID, but it can also perhaps be for other situations, other climatic situations. We've seen recently that due to forest fires, landslides, river flooding, roads have been closed and it's been impossible to get from point A to point B. You might not be able to get to the airport. There might have been a terrorist attack in London and the train system and subway has been shut down for a day or two, or a protest in Barcelona by the Catalans who want to protest. And so there are a lot of things going on why you can't do that. But if you have a medical reason why you get called up for jury duty, your house goes on fire and burns down, and for some people you lose your job or your job transfers you, these are valid reasons why the trip cancellation and trip interruption insurance comes into play. So it's very important to read the fine print on any policies. Make sure you're aware of what's covered in our McGill policy. Make sure what's aware of any policies that you do take up afterwards. So for information on McGill's one, you can call their customer service, see their website. There is another policy that Joan Wolforth had put me in touch with before, Johnson, and because we're a member of CURAC, the Canadian Colleges and University Retiree Associations of Canada, they have a standalone trip cancellation and trip insurance policy, which you can take for a year. In many cases, trip cancellation and trip interruption insurance, these are a one-time, only every trip you go on, you have to take it. And it depends on the fixed costs that you've already paid, how much of that is that the policy will cover. And so you have to perhaps take it out multiple times. The Johnson one is an annual policy. I couldn't get an answer just yet as to whether or not they're covered for COVID or not right now. And then there are other insurance policies, CAA, Snowbirds, CARP, the McLennan Group under, which is CARP's insurance policy, the Canadian Association of Retired Persons, TD, and Royal Bank and many other places that offer such insurances that you can look at it. Your credit card, depending on what type of credit card you have, it may say that it's got some trip cancellation and trip interruption coverage. Read the fine print. It may be for 2 weeks for most people, but not for those over 65. It may be only for 2 or 3 days. They may have a more extensive medical stability clause there, which may make it very unattractive. So that's something that you can look at. Some people say, well, I'm in good health. I can't see that there's anybody near me that is likely to be so ill or die that I will. Yes, Johnson has single trip ones as well as multiple, but the multiple one is very little cost for the year. So you may say, I'm going to take a chance that something will not happen and I won't have to cancel my trip. And if I do, I'll just absorb the cost. And over many years, you say, well, I've saved hundreds of dollars along the time. And if something happens, well, this time my luck ran out and I have to pay for it. And so different people are different risk tolerances for their health and for travel, and keep that in mind. Next slide, please. Another option that one may want to keep in mind is, now that we're retired, most working people are traveling for a week, 2 weeks, maybe a month if they've saved up all their holidays, but it's valid for up to 90 days. And some retirees do want to do long stays and be away for a longer period of time. Some even want to be away for an even longer period of time than the 90 days are approximately 3 months. So you can ask the insurance company if you can, how much it would be if I could have an extra 10 days insurance policy. And there will be a little questionnaire that they will give you, how old you are and perhaps your spouse, if you have eligible dependents. What is your health situation? They may ask you questions about, would you have any heart conditions, lung conditions? How many medications do you take per day? And so on and so forth. Where are you going? How long do you need this extra insurance for? And then give you a quotation as to how much it will cost for you to have insurance for an extra 10 days, an extra month, an extra 3 months. So it can be costly. We did do it once where we wanted an extra 10 days. Warren at that point had hit a 0 or 5 age group. And so he was in the next category up. So it cost us $130 for the two of us for an extra 10 days. His was slightly more than mine, but it averaged out to $13 a day. The older you are, the longer you're going to be away, the more health conditions you have, the more it might cost. And at some point, it may not become very cost effective and you decide to either shorten your trip, or for some people, if they're not going too far away, they find out that it is cheaper if they want to spend the winter in Florida or in Mexico or in Costa Rica, to go for 2 months, come back for a few days or a week, come back for Christmas, come back and see their accountant and get all their tax papers handed in, and then fly back down again for another 2 months or 2.5 months. And so that sometimes can work out well. It doesn't work very well in my situation with our son being in Australia. You know, it's a 20+ hour trip to come back and go back again. The costs are not feasible. So, and again, McGill's not going to provide you with any advice or any recommendation on these extra policies, but if you're interested, you can check them out yourself with our Manulife insurance provider and or with other companies and see if one of them might work for you. Next slide, please.
I don't understand why sometimes it works. Hold on, it's skipping again. There we go.
Okay. Now on to just sort of some more general information on things to share. The first one is just a reminder that whether we were vaccinated or not, our policy always covered us for COVID. Other policies changed in March of 2020 and began telling people they had to hurry home, otherwise their coverage would be terminated. Now with the level 3 travel advisory, where the government recommended that one avoid all non-essential travel, a lot of us weren't traveling. That has changed now. It's country specific. There are still some countries that have a level 3 or level 4 advisory, such as they say level 4, avoid all travel to North Korea and Syria, for example. Not that that's high on many people's bucket lists right now. And right now, cruising is still a level 4, avoid all cruise ship travel. So we have had policy, we have had coverage, even though some of us may not have realized we always had coverage. And some people did decide to go down to Florida last year or to take a trip to visit family somewhere else this year. HR does recommend that you may not be covered if you have COVID when you're leaving the country. And so they recommend that you might want to consider getting a negative COVID test before you leave in order to be able to prove that you didn't have COVID. Now that proves you didn't have it at that point in time when you took the test. It doesn't mean that you're infected and you might show symptoms the next day or the day after. Obviously, if you're away for more than 2 weeks, since the incubation period is sort of 4 days to 14 days, then it's obvious that you contracted COVID while you were away. However, if it was more recent, maybe a negative test would be enough to say at the point of time you left. And many cases, things are changing, and to go to the United States, you now need some sort of COVID test to enter. So it may be a moot point anyways. For most of us, we are hoping that being doubly vaccinated and or with a booster shot, that we will not catch COVID. That if we do catch it, we're going to be asymptomatic or have a very mild case, and we will not need any medical care. If you don't need medical care, then the emergency travel medical insurance does not come into play. So if you don't need a COVID test and you take one, you may have paid $100 to $300 for something that you never need. So regulations change. Be prepared. You may have to take extra COVID tests. A cousin coming up the other time had a COVID test. When they left North Carolina, they got partway up, had car trouble, had to wait for a part in the car, so they had to take another COVID test. They continued up and got to the border 74 hours, not 72 hours after their tests, and were told they couldn't get through. They'd have to go and take another test. So you never can tell how many tests you're going to have to take at your expense. So the government advisories are now country specific. Check them. Check them when you plan your trip. Check them a few days before your trip. Keep on checking them because things can change. Okay. Just read the fine print. Read the fine print. I can't emphasize that enough. Next slide, please.
I'd like to make a reminder to everybody to please ensure that they're muted.
Okay.
Okay, thank you. Okay.
So another travel section, this one was for part of the UK, just things to keep in mind. I mean, not necessarily in the UK, some of it's general that they put from one place to another. If you're going to the UK or the US, then your COVID test is in English and they can read it there. But some countries that you're going to, you may need a translation. You may need a notarization or a legalization of the document. So it's really important to check out the destinations that you're going to or traveling through to get to a destination to find out what the local authorities require. There may be entry bans, there may be exit bans. In some cases, it may not be an exit ban, but they may have an exit departure tax that you have to pay in local currency. So you may need some currency. Quarantines may or may not be imposed. It may or may not be at your expense. You might require different health screening questionnaires, as we've seen here. You might require adequate proof of travel insurance. I think your little card will cover that. There may be border closures, airport closures, etc. Next slide, please. And these things can change. And it can not only be the fact that you have COVID or you've come in contact with somebody who's had COVID that you might be required to self-isolate, but airlines can suspend flights, reduce them, and make it very difficult to get to the airport or get out of the airport. So you have to monitor the information, check with your travel agent, tour line, etc. And the government of Canada, the consular services, even if you're registered with them, they will not provide money if you need extra money in changing your flights, help you change your travel plans. So you have to be aware of what can be done and how it should be done as early as possible. But you may want to, so a couple of other links there. You may want to register yourself with Canada government agencies in case you should need consular services, or in case somebody from home needs to contact you, they may be able to do so. Next slide, please. Passports, not only check your date, some of these things, we haven't traveled for a while, you may have forgotten some of these things. Check the date of expiry on your passport. Some countries and places require that you have a passport that is valid for up to 6 months after the expiry date. In case you should get stuck there and need to extend your stay, they want to make sure it's valid. If you have 2 passports, you may need to carry your Canadian passport to exit and enter Canada. You may need the passport from the other country to enter and exit that country. If you're a dual citizen, some countries will not recognize Canadian citizenship while you're in that country. And so they will not put you in touch with or allow you to contact Canadian consular services. Travel visas, some require them for visiting. They do require them for student visas and working visas, but some require them there. So check it out whether you need to do it electronically or whatever means. How long are you allowed to stay in the country under a visitor visa? And can you extend it from within the country if necessary? Some will ask for proof of a return ticket and sufficient funds so that you will be self-supporting during your stay. So don't just show up with a one-way ticket, planning to book your ticket later on, open-ended. You may find that you have some difficulty getting on the plane. or getting off the plane and through immigration in that country. Local currency, just keep in mind that you may need to have some local currency. There may be various regulations there. It may not be possible to use your credit card or ATM. Make copies of your important documents. Leave a copy with somebody trusted at home in case things get stolen when they're away. Have a copy with you and somewhere else, although that's always makes me feel a bit uncomfortable. But also don't carry everything with you. One of my son's friends, they were out in Trafalgar Square, and in his backpack, he had his passport, credit cards, all his money, his ID, et cetera, et cetera. This was pre-COVID. Put his backpack down to take a picture, turned around, the backpack was gone. He was left with nothing. Had to get in touch with the Canadian High Commission and get in touch with people at home and get some money wired to him and get documents replaced quickly. And so this can be a problem. Make sure things are in a waterproof bag in case you get them wet, and you may want to have a hidden travel wallet and so on. Next slide, please. Just be aware of your surroundings, be aware of your destination, things that you should be aware of. In certain things, there are different scams and tourist pitfalls to be aware of, pickpockets. If you're in very crowded, very isolated places, don't leave your gear unattended. You hear that all the time at the airport. Be wary of COVID scans. You know, there's new scams about the ArriveCan app, about COVID cures, COVID tests that you can buy online, or they take your money and you don't get anything. Other misleading scams. And of course, we have to keep our public health measures still active, because although COVID reduces the chances of serious illness, hospitalization, or death, it does not necessarily 100% protect you from catching COVID. So we still have to wear masks, use good hand hygiene practices, and make sure there's good ventilation and social distancing in place. You may want to bring your masks with you. You may even want to buy a box of medical masks and bring it with you. I've heard that in hot, humid climates, if you have a cloth mask, it can be very uncomfortable. And so wearing one of the lighter medical masks is more comfortable. And if it gets very hot, you can take it off and put another one on if you have them. Situations, if it changes, it may be very difficult, if at all possible, to buy any personal protective equipment. And if you're traveling through places and in a place for a day or two, you may not know where to buy it. Be prepared for a longer time to get anywhere. We've already been exposed to that in the last few years, but expect that it will be even longer still. So don't plan to arrive somewhere and do something immediately afterwards. People used to plan to take the morning flight and travel directly to the office for a morning meeting, or they may set up something that you're going to do. You're catching another plane, catching a bus to move on to your next. The wedding is the funeral's that afternoon and you're going to arrive on time. Expect that it's going to take longer to get through the airport when you're leaving, to exit the airport and get through immigration when you get to your destination, and so on. So allow lots of time going on. And now Kate's just come back from Maine, so I've asked her to give a few words to everybody about some of her experiences.
First, let me say, Kathy, thank you for an outstanding presentation. This is certainly a lot of information to take, and just to remind everybody that you will be getting a copy of this. So I was in Maine for American Thanksgiving, very happy to finally be able to see my family. And it was a very educational experience. When you return to Canada, you have to complete what's called the ArriveCan. It's a website and it's an app. You're much better off using your tablet or your phone to put it on there, because this way, when you get to the border, you can just show them what you have, but you also need to print out all the information. I highly recommend that you look at the ArriveCan site so you can see what kind of information you're going to be putting in there. It's your proof of vaccinations, and also information about where you will be isolating yourself if necessary. It took me about an hour each for myself and for Sean to do this. And you have to do that 72 hours before you return. So keep that in mind. There's also a YouTube step-by-step that you should watch before doing it, just to make sure that you have everything there. And again, once you submit all the information, you will receive a receipt that has a code. It also has a QR code that can be read. Now, this was my experience. We came back through a very rural border in northern Maine. When I got there, I had everything, and they did not have Wi-Fi. So he could not read what was on my phone. So he goes, well, I think that the US side has Wi-Fi. We had to turn around, go back to the US side. And at that point, I accessed their Wi-Fi and put it on my phone so that the Canadian border could read it. They were extremely embarrassed. But this is something to keep in mind, depending on what border you're going through. Number one, you just need to have printouts of everything and have it on your phone. I just read an article yesterday that an older couple didn't know about the ArriveCan, and they showed up with their proofs of vaccinations that we all receive. They did not accept it because so many of them are being counterfeited, and they required that the couple self-isolate for 2 weeks when they return to Canada. So this is something else to think about. Oops, hold on. Hold on. Okay, so Kathy's going to have some last words. And after that, I have a little announcement for people before we get into the Q&A session.
So as we can see from what Kate has said, just an extra impromptu, it's becoming more important technology. To have a smartphone, to have a laptop, to have a tablet to bring with you, to be able to have all of these informations available on your phone, your passport proof, your Manulife one, your vaccination proof, and the ArriveCan, because the government is not accepting the fact that you didn't know that you have only a paper copy because of possible fraudulent ones, that you didn't get the email confirmation, although they are beginning to loosen up in last night's news because they're realizing that some seniors don't have these devices, don't know how to use them and upload things. Imagine if it took Kate an hour to upload these things, how long it will take some people. And others can't afford data plans to be able to have the roaming data, to be able to have it available. In some places you arrive and there's no cell phone service, and the little border crossing in Quebec there did not have Wi-Fi.
Most important. Yeah, so both of them. Also, I meant to speak a bit about the testing experience that I had. I see Al Yeager is raising his hand. Thank you for reminding me about that. Depending where you, and again, I'm only talking about in the US, depending where you are in the US, there's a pharmacy called Walgreens, okay? And they are offering free testing services. The best thing to do is go to the Walgreens site. Yes, we are required to do the PCR test, but apparently let me see if I had it on the slide. Hold on a second.
You missed one, didn't it?
Yeah, I did. Here we go. Yeah. So you have to have the results of the COVID test 72 hours before you return to Canada. And you also need to have the printed results of that with you, as well as on your tablet or on your phone. And, but like I said, Walgreens has a free testing. And when you get to the site, you will see this is what is accepted. The rapid antigen tests are not accepted, okay? In my case, when I was down there, I was so busy with the family. I assumed Walgreens would have the right information. And when I went in, she goes, no, you can only have the PCR test. That's all that they will accept. I've been in touch with Al Yeager, and he says when he brought up the site, it says here that the NAATS are also acceptable. When you have the PCR test, it can take at Walgreens 3 to 5 days. So you're taking a chance. I was lucky it came in 3 days. The NAT test, he said he got his results in, I believe, 24 hours. And I'm going to ask Al to speak a bit to this. But again, when you're outside of the country, if you're going to other countries, you really have to look into their areas to see what they have available. So Al, could you talk a bit about your experience? Unmute yourself. There you go.
Sure. Thanks, Kate. Yeah, I've been 3 times out of the country. Once I drove to Virginia in September, and then I drove to Virginia for Thanksgiving. That's where my brother lives, and I went to Mexico by plane. When I went in September, Canadians weren't allowed. I'm American citizens, so I came in. The two pharmacies that are the big ones are CVS and Walgreens. I like the CVS site better. Now I can put in a social security number and then it's free. Now, I don't know if you basically declare you have no insurance and they'll give it to you. Now, what happened when I went 2 weeks ago, nobody asked for any ID of any kind. I went to both of them because I wasn't sure about this NAAT test, which I got the results in 1 hour. And I had a problem because I was driving back on Saturday and there was no free testing on Thanksgiving Day.
Right. Yeah.
So I went on Friday morning. And I got my and the NAT at Walgreens. It's only available at Walgreens. It wasn't available in September. It's done in-house, and they say 24 hours. Like I said, I got an hour. The other one, they told me 24 to 36. The first time was 30. The next time was 34. I had a backup plan to drive along the border towards Messina, waiting for my results, which I didn't need because I had the NAAT test. Now, you cannot start the ArriveCan until 72 hours before. So if you start at 73 hours before, they won't accept it. You have to say where you're going and what time roughly. I wanted to see whether there was a wait at Thousand Islands. Otherwise, I go to Ogdensburg. And so I actually was in a parking lot in Watertown and then submitted it from there. And by the time I got there, I thrust the QR code in the guy's face. He says, "No, I've got it." Now, Thousand Islands is a big crossing. And the airport would be the same way. They would have it in their system. You know, if you've submitted even from the airplane, I'm sure it would be in their system by the time you get to immigration. But where Kate went, I don't know how that works.
Well, like I said, I literally did it at the US border and they accepted it.
Yeah, okay, exactly. So it's in their
Right.
system. So once it's in their system, they're wired.
Mhm.
They're wired.
Yeah.
So
Mhm.
I didn't have to, I showed it to the guy and he didn't even, he said, "No, I've got it." He could scan my passport and it linked to my ArriveCan.
Right, that's all in the ArriveCan. It's so important that you take a look at that YouTube step by step, because there's a lot of information that you have to put in there, and you have to make sure that also that it's entered correctly. But again, depending where you are in the States, check out the CVR, check out the Walgreens to find out what's going on. And again, it depends. It could differ. Like the Walgreens where I was did not have an in-house facility. So that's, why we had to, where Al was, it did. So
Not all of them did, yeah.
So that can make a big difference, yeah.
There was less testing available than in September.
Right.
The other thing is Derek Hart, who is retired from McGill and Dawson. He goes to Florida and we play golf with him in the Mura. It seemed to be more difficult to get the free test in Florida, but his son works for CVS. So somebody commented it may vary by state. I was looking around for a Thanksgiving Day test and I didn't find one that was free, but I did find a site at a library that says anybody can come, even foreign passports. Again, so there's, if you run into trouble, if you have the time and the ability to search around who's going to give it to you, because basically the government picks up the tab.
Yeah. That's one thing that's important, is to look into the testing as soon as possible, because you may have to book it. It may not
When
be
you
available
arrive,
at
yes.
Walgreens. It may be available only as a drive-through, and if you don't have a car, you have to rent an Uber to go through. And so the closer it gets to the time, the more limited your options are, especially if you're traveling with a party of 4 or 6 people and you all want to get tested at the same time, and you're staying in a more remote location, have to drive there, get tested, go back. So, check in advance for that to find out when it is and different costs at different places and timing that it'll take to get there. So I was concerned, Kate, when you'd said before you had to enter this information 72 hours, but it's up to 72 hours before your expected arrival back in Canada, because you have to enter your negative COVID test results, which of course you have to have that within the 72-hour frame.
Has anybody done that? I have.
It wants your vaccination proof. Okay.
Yeah, not COVID
Yes,
test.
not your COVID
Oh,
test.
not the COVID test.
No. See,
So you
that's
can do
why
everything in
information in
advance.
there has to be, but if you have to self-isolate, you have to put that information in there.
Well, you have to have the COVID test. So how do they check the COVID test? They check
You
that
have,
separately?
you get an email. You get an email from like CVS or Walgreens, you get an email with your results. Okay. But I also highly recommend that you print out those results.
So you have to tell that to the border guard.
You hand it to
Yes.
them.
Yeah.
You hand it to them
Yeah.
at the border
Yeah.
guard. Okay.
Yeah. You have
And
to
I
do
guess
that.
you have to put on your ArriveCan your backup quarantine plan in case you should need to quarantine. And if you
Okay.
don't, then they may end up sending you to a hotel instead of letting you go and quarantine at your house. And when you're traveling as well and going through places, have a backup quarantine plan in case partway along the trip, you're told you have to quarantine. So don't all of a sudden find out then that planes aren't flying, you have to stay over, and the only place left available is $1,000 a night hotel.
I traveled back from France end of October, and I needed to upload the PCR test as well as the vaccine passport information.
I had mine earlier and I couldn't find it. I came from Mexico and I showed it. I think I didn't even show it at the border. I showed it at the to get on the plane, but I couldn't figure out how to upload it.
One of my little last words, even the border guard said this is so complicated. Okay, because you might think you've done all the right things. It's a state of affairs the way it is right now. So when you do get to the board, you really need to have a lot of patience. So Kathy, this is the last words.
So this has been a very general information session, a lot
Yeah.
of information, but very general. Depending on your particular individual situation, health needs, where you're going, etc., contact our Manulife customer service department at 1-800 get put through to find out the answers that would be right for you. If you have any concerns about pre-existing conditions and wanting other things, so check with them. And I would like to thank Kate, thank Genevieve from HR, and of course to thank McGill, because we have this wonderful opportunity to travel and to be covered for emergency medical costs, which go up and up for people who have to buy separate plans to a point when it becomes more to pay for insurance than the cost of the trip. So over the many years, the university, the staff benefits, the various staff faculty associations have fought for us so that the benefits at McGill go from the time that you're hired at McGill until death, and they don't stop at the point of retirement. So thank you for your attendance. And if Kate has any last words before we open it up to questions, I guess if you put your hand up electronically, then or use the chat one, then Kate will be able to find out who's wanting to ask or answer something.
Thank you, Kathy. So just as I mentioned, we have a little surprise for everybody who's attended this session. Just see me if I can get to it. Okay. Claude Lalonde, one of our wonderful members, has 4 tickets that he would like to give away. I don't know if you've heard about it. It's called the Illumina by Cavalia. This is the website. Okay. Apparently it's a huge light show up in Laval. So the way we're going to do this, if you are interested in attending, please send an email to muraarum.association@mcgill.ca. And the tickets will be given out on a first come, first served basis. And whoever wants those tickets, we'll ask them to get in touch with Claude and he'll get them to you. So good luck, everybody who would like to get the tickets. So I'm going to close the slides right now and open it up to the Q&A. So just unmute yourselves. Okay. So does anybody have a question?
Just one last comment about ArriveCAN for nervous people. You can't submit it unless it's all filled out. And if you're nervous, if it's submitted, they've got it, and then keep every paper copies and electronic copies of everything with you. And I don't think you can go wrong.
Thank you, Al.
The problem of 72 hours is a very common one. We came back last night from Florida, and our flight was delayed more than 4 hours. We were tested PCR with CVS, time enough, but our time expired on it. If you are in those kinds of situation, it is the departure time, the official departure time. So there you have a little coverage. They allow you to still arrive. So we were allowed to come in yesterday because it was because of the weather here, the flight didn't come to Canada in time. That is one thing. And when you fill the arrive can, Susie filled it out. The whole thing was filled up. They want you to upload, as you say, your vaccination proof as well as your quarantine backup plan, and then you just declare that you have a negative test, even though you haven't received the answer from the testing service. That's the best way to move forward. And once you get the proof on the email that yes, you have that, then it's put together at the arrival or by the airlines who are checking you. So that's how it all merges together. Backup plan for having the results within 72 hours is a very critical challenge, but we cannot help that. CVS and Walgreens are a good thing. In some places, you do have quick results within hours at the airport, like Fort Lauderdale and others, that costs you money. But if you have to, this is what is the backup plan that you have to have. In Europe, you have to do 4 paid tests for coming back, like in France, 45 euros or something for your PCR tests.
The rapid antigen test at the moment is accepted for entry into the United States, but it's not accepted for entry into Canada.
Yeah.
Could I just ask that the slides will be forwarded to us as a request?
Yes, yep.
Okay, thank you.
No
Do
other
we-
questions?
Well, I have one question.
I-
Oh, sorry. Go ahead.
okay.
Vera. Please, go ahead.
I just want to know, do we have to, if we're driving to US, do we have to do the test before going or just for coming back?
Yes. You have to do the test.
Before going?
Mhm.
Wait,
Yeah. Results to drive across the US too.
no, we did not need to have a test when we were driving down.
But now they are introducing it again.
See, this is why we're emphasizing, yeah, it changes.
It's the-
Yeah, by the hour.
Because in the news so far, they didn't say anything changed for the crossing the border by
By
car
car.
or something. Only
Sure.
flying, they said. But I
Certainly,
don't-
US citizens don't need it to get in, but
No, no,
Canadian
Cana- we're-
citizens, and US
we're
citizens can come in unvaccinated. Canadian citizens need to be fully vaccinated to get in.
No, no,
US
we
by
are
land.
vaccinated even with the boost. But
She's
To
talking about
go in-
taking the test.
yeah, taking the test while going.
With
I
the
drove
Omicron-
yesterday across the US-Canadian border and I was very well treated and I have not been tested. And the guy said, take your mask off just to check your Nexus card. And the reply to that was, welcome to the United States. And there was no testing whatsoever to get.
But that
down
could change,
to
yeah, yeah.
Okay.
And you can't always depend that every border guard is completely up to date on their requirements.
That's another thing, Kathy, good point. It really depends who you're talking to, and who you're dealing with at the border, yeah.
Question, what is known about Cuba these days?
Well, I looked it up
Traveling to
on
Cuba
the
and back,
on the
unfortunately.
travel advisory, and it's under the normal security precautions to go level 1. So that part is good. They've changed their peso down there, and if you have any old Cuban coins, it was only up until December that you could change them in. You're not allowed to bring in Cuban money or take it out. US currency is illegal. It seems that things are pretty good down there, but read up on the Canada Travel Advisory. It gives you all kinds of very useful information about going to Cuba and every other country.
Sure.
How easy is it to get tested in Mexico? I'm not sure. Al?
Yeah, well, I was in Isla Mujeres, which is a huge tourist area. There was testing right at the ferry. It was everywhere. And we got a, what looked like professionals test, and we had to wait a little bit. But yeah, it was, I mean, if you're in a tourist area, Americans, Canadians, Europeans all need tests. The Americans need the antigen, Europeans and Canadians need PCR. That's what they gave. The turnaround was 24 hours on the PCR, as advertised. I
So
got
I
mine in
was-
like 18. It's faster than CVS.
Thanks, Al. Okay, I want to say something. Go ahead.
Yes, Sylvia.
I wanted to say that I was in Mexico in Cozumel, and to get the PCR test, they would only accept $125 in cash, US cash. They did not want any other currency. So that's another thing to be aware of, depending where you are. This was Cozumel.
Yeah, that's useful because in Isla Mujeres, it was 100 US, but there was a money exchange. It was basically 2,000 pesos. They would take credit card for a fee, and there was a place that exchanged Canadian money at 80 cents to the US dollar, so that their Canadian money was accepted, but not to pay the test. But having cash for your test is a good idea. In fact, I thought about that, to have like $300 cash for two of us, just in case I could only pay cash for the test.
Yeah.
Lots of good information on the chat line as well. I'm just checking to see if there's any questions that haven't been answered. Quite a few people have been doing some traveling internationally. Bravo. A good point that somebody's mentioned in the chat line is to take screenshots of different documents as well. So if you don't have data available or you can't access things, at least with the screenshot, you can pull it up from your photo gallery. Well, we're just about at our 12 o'clock. I'm very pleased that we've managed to keep within the time frame. I spoke very quickly. I hope it wasn't too quickly for some people because there was a lot of things I wanted to just go over. But I appreciate you're all coming here. It's good to see so many of your faces and to know that you're traveling and have been traveling safely and starting to enjoy travel again. So it's up to everybody to assess their risks and what they want to do and get back out there and go for it again. I don't know if Auntie or Jeanette, you want to say any closing words?
Well, perhaps I could add thank you in the name of Mura. You have done, as usual, a very thorough job, and your documentation is going to really answer many of the questions that we didn't have a chance to ask. So thank you again, and let's travel.
Yes.
Thank you, Kathy. I second everything that Auntie has said.